Washington Regional welcomed me from day one. I came here 16 years ago as a fresh graduate from my residency. Being a hospitalist at that time was a very kind of a trend that was catching on across the country. And there's 30 hospitalists now in our group, 30 providers, and we've just grown exponentially. And now starting internal medicine residency here at Washington Regional has been really full circle for me. To be here the last 16 years, coming straight out of residency as a baby doctor, and now seeing 24 internal medicine residents up in the GME space that are going to be the future doctors of our area is really exciting. And not just from an internal medicine standpoint. We have neurology starting, we have ED starting, we have general surgery residents running around here, and we've got an amazing sim lab. This is becoming a major academic center. I can't imagine the possibilities another 16 years from now. I think Washington Regional is different in the sense that we are locally governed and we have a clear mission to serve the community here in Northwest Arkansas. And the guiding principles, I think, have never changed. I have zero doubt that our CEO, COO, CMO, their driving principle is what's best for the patients and for the community here in Northwest Arkansas. It's hard to talk about my experience at Washington Regional or healthcare in the last decade without mentioning the COVID-19 pandemic. I think Washington Regional's response to that was exemplary and was a model for hospitals across the country. For a hospital our size to not only take care of our own community, but to both educate the community and get the message out to where we were on national news, and then to see all the transfers from you name the state, not just in our area, Mississippi, Texas, Oklahoma, I mean, I could go on. There were folks in hospitals in a rural setting that needed ICU care, ventilator care, really sick folks, and we were able to take those patients from all over and provide medical care and literally save some lives. I think if the community could know one thing about Washington Regional, it is that we are truly here to help the community in whatever way we can. For example, just out of a need in the community, we began a project where we're serving our homeless population. And there was kind of a program in place, but they needed the medical side of that, from the funding side to the providing the physician side. And that's a way that Washington Regional just saw a need in the community. And a few people got together in a room and really made that happen. So it's easy to see on like social media and places where you see this banner that says Washington Regional, best hospital in the state. And that's not like a slogan that we've come up with. That's legitimately like metrics that we have met, that is an independent source that has looked at all these metrics of how a hospital performs and takes care of their population. To do that one time is a pretty big deal. And to do that 5 times in a row, I would like for people to know how big a deal that is. To be the top hospital in your state is an amazing achievement. Washington Regional has taught me to be a physician. This is where I learned to be a physician. This is where I learned to take care of folks. And so many of my colleagues and administrators and nurses and techs have really become not just friends, but family, and have helped me grow in my career and just made me a better human along the way. But if I had a message to say to Washington Regional as an entity, it would be more to the individual people that make up this place, and just to say thank you.